Medicare and understanding Medicare for about 7, 8 years. And I say jokingly, late in life I have discovered my superpower. I can explain Medicare to people.
That is a superpower.
It is a superpower. The first couple people who were here decided was I was not going to set up my screen and my PowerPoint, because the PowerPoint that you are getting this handout from, we usually do at the libraries for about 2 hours. And I may even have a schedule of where we'll be if anybody really wants to come and hear it all. But instead, I'm going to first go through some of the things about the changes for 2020. And then I think what we can do is, with my bigger part, I'll just go through and I'll tell you what to look at, and we'll talk about a few things. And very quickly, with this size group, you got questions, you just ask them and we'll go from there. I am guessing that many of you are fairly, you've heard about Medicare for a while, and so it's not when I do the presentations at the library, I will have some people, sure.
I'm sorry to
That's okay.
Are there more handouts for those?
Yes, I'm sorry, thank you very much. That's good thinking. I'm going to put them right here, and they're alternate left and right if we want to. Yes, there we go.
Thank you, I'm sorry for the
That's okay. So one of the things I say when I do the presentations at the library is I come upon people who, as I say, are aging into Medicare because they're hitting near 65, and either they've had really good health all their life and everyone in their family, has had pretty easy, quote-unquote, things. And so whether or not the health insurance that they had from an employer, since that's mostly how people get it, they didn't have to worry about how much it's going to cost me here, how much it costs me there, because by and large, most people up to 65, don't have that many health issues. Obviously, I'm here with a support group for people who know that doesn't hold up for everybody.
Amen.
So when I do those presentations, one of the things I'm saying is everybody's situation is a little different. Because I always have people sort of saying, well, what's the best thing? What should I do? And that's a really hard question because people's needs are different. Though, as you all know, when you have more health care needs, you really have to concern yourselves a little more with, is this covered? Is this not covered? Who's doing what? And one of the other things I say, and then we'll get on to my slides, is with car insurance and homeowners insurance, most of us hope to go through our whole lives never having to make a claim. We pay those premiums because if something big goes wrong, we know we want that coverage, but we may go our whole lives never making a homeowner's claim or a car insurance claim. Health insurance is a whole different thing because health insurance has to do with how much is on me, how much is on my insurer, what is the doctor allowed to charge, what can the hospital charge. It is always about how we do this cost sharing. I just read an article, this didn't have to do with Medicare, but just how many employer groups now have these high deductible plans that people are dealing with, and we are back to people either being hit with having very high deductibles, a lot of co-pays, being really hit with this, and not seeking the medical care that they need because it's too costly. We were trying to get away from all that, and that's really problematic. Medicare isn't quite like some of those things, but it still has its issues. So that's my basic first spiel. Now I'm going to get to the part that is separately stapled that says Open Enrollment 2020 Changes. And I just want to bring up a couple things with this. One of the biggest ones is about this Medigap Changes. And so do you know when I say a Medigap what I mean? Is that a familiar term? I see some, okay. What this means, and let's see, I won't use a slide right now. The basic two ways people get their Medicare coverage. Original Medicare And when someone is on original Medicare, they may purchase a Medigap, or they may have a supplemental from a former employer or TRICARE or something like that to cover the cost that Medicare doesn't, and they may have a drug plan. The other option are the Advantage plans, and there's a kind of dividing line, and I will talk more about that. But when we talk about these Medigaps and these supplementals, up till now, the one that you would hear most often about people having was Plan F. And the reason that people liked Plan F was because it filled in pretty much all of the gaps in Medicare. So if Medicare, when I use the term Medicare covers something, doesn't tell you anything about how much. But if most of you know that the basic thing is I see a doctor, I get lab work, I do things like that, Medicare may pay 80% or will pay 80%. If I have that Medigap, it's going to pay that remaining 20%. And what people liked was there are a few other little bits and pieces of that Plan F covered nearly everything. So by paying those premiums, people were not going to have any out-of-pocket costs, or next to no out-of-pocket costs. So several years ago, our legislators, in all their wisdom, they decided that what they didn't like about Plan F and also Plan C was that those started paying without even making the person pay the Medicare Part B deductible, which is under $200 still. They felt that by not even having that deductible, people didn't have skin in the game.
But you have to pay for the plan.
That's right, you're paying premiums. So, and they also had this, as I say, an illusion that, I'm going to say this in a really obnoxious way, that people take up going to the doctors as a hobby. And that if I don't even have to pay that deductible, I'm going to go running in with, a hangnail. I would say to you, I haven't met too many people who do that. I have met people who, rightly so, say, I'm not feeling, something feels weird. I'm not sure what it is, but I know something feels weird. I want to go see the doctor about that. So, in their wisdom, they then said, okay, after 2020, or starting with 2020, nobody else can buy plans F and C. However, anyone who already has a Medigap Plan F or C can keep it until the end. And there's even a technical little thing. If I hit 65 before January 1st, 2020, even if I had did other things, I could still get that Plan F. But essentially what has happened is that going forward, Plan G is going to become the most popular. Because if I have an F, if I'm an insurer and I have an F plan, and just to use dumb numbers, I have 100,000 people in my plan, but now I can't enroll anybody else in this plan. Gradually, over time, I'm going to start losing some of that 100,000. So there is some concern that those Plan Fs eventually will become more expensive. Whereas G will now be the growing group with more people, so they will be a little bit better able to manage their costs. When I'm talking about all that, on the back of this one that says Medigap Changes effective January 1st, there is my chart that shows what I'm talking about in terms of what a Medigap does. So again, if I'm on original Medicare and I also have a Medigap policy, one thing that means is, somewhere on my list, it says the Medicare Part A deductible. Part A is if I land in the hospital. If I only had my original Medicare, no supplemental, as I say, kind of the way people did it in 1965 before they had all these things, but, sorry, there we go, thank you. But with today's numbers, So if I just had that original Medicare, no Medigap, and I landed in the hospital, I would have in 2020, it will be a $1,900 something dollar, oh yes, no, 13, I'm saying 19, $1,364 in the hospital before Medicare starts paying its part. But if I am paying monthly for this Medigap insurance, then they would pay that if I land in the hospital. And also along that list, you see the Medicare Part B co-insurance or co-payment. And for most of these Medigaps, where they have the check mark, it means I don't pay it, my Medigap pays it for me.
I wanted to make a
Yes.
note, I don't think it applies too much here,
Yeah.
but I'm under 65.
Thank you. I was going to ask about that.
Yeah, and I'm on disability,
Yes.
and I have Medicare, and in the state of Arizona, I'm not allowed to get a Medigap program.
That's right. Two important things about that. Lest we hate Arizona so much for doing that, which is rather annoying, but it's really 30 to 35, 40 states. Don't let people under 65 get a Medigap. However, and this is the most important thing of everything I say in a group like this, when she hits 65, she gets a 6-month period where she could get a Medigap with no medical underwriting, where they cannot ask about her health issues. Now, some people are not going to choose that, sometimes because of cost. But some people who have been on Medicare because of a disability are just waiting for that day when they can make that shift. And one of the reasons for that, and I apologize because I know I go all over the place with things, is please know that I am not in any way saying that Advantage plans are bad. They are not bad. They work very well for most people. However, for people who have a lot of health needs, if you compare someone original Medicare with a Medigap to being on an Advantage plan with their co-pays, even with their out-of-pocket limit, if I already know that I have a lot of health needs, it's gonna cost me more on the Advantage plan.
And it does.
And it does. So that regaining that right at 65 can be really important. Now, it's only a 6-month guaranteed issue. If I didn't do it then later on, sure, I can apply for a Medigap, but then they can ask me about my health. And they can turn me down, or they can charge me more than the quote-unquote average person or the standard person coming in. If I get a Medigap, the only way they can throw me off, so to speak, is if I don't pay my premiums every month. Someone said as we were getting set up, someone said, oh, I'll be so glad when all those Medicare commercials stop on the TV, because there certainly are a lot of them. What are they advertising?
Advantage
Advertising
plans.
Advantage plans. And again, as I said before, when we talk cost sharing, when someone signs up in an Advantage plan, they still pay that Medicare Part B premium. Nobody doesn't pay that except lower income folk. Behind the curtain, so to speak, the feds are giving that money to the Advantage plan that I sign up for
To administer our health.
to administer our health care, and giving more than that amount, but I will have co-pays. And many of you know some of them might be, so like when I talk original Medicare and a Medigap, if I have original Medicare and a Medigap, I go into the hospital, that deductible is paid by my Medigap company. Because, as we say, I'm paying them a premium every single month. On the other side, if I'm in an Advantage plan and I land in the hospital, I'm going to have a daily copay. Some of them charge it for 5 days. Some of it charge them for 7 days. I do have handouts with the for 2020 how the different Advantage plans set up their structure. So if I'm 65 and I've had no health issues in my life, I may choose an Advantage plan because I say, yay, it saves money. Look how much it saves me. I don't have to pay that other premium. I don't have to pay a drug plan premium because it's bundled in. And I can fully understand why people make that choice, because sometimes saving some money in the short run is a good thing to have it later on. However, if I go into it and I know I already have to see a specialist every month, have to have certain lab tests every few months, I can quickly see that it may not be the best for me. It is always this kind of comparison, and with everybody, it's the costs and the coverage.
Right.
And I say, I wish we all had that magic ball and knew just what was coming down the pike and what we would need going forward, and we don't. I use a stupid little example. If I had two twin sisters, and at 65, one goes original Medicare, Medigap, and a drug plan, the other goes into the Advantage plan. And for 10 years, these ladies are in such great shape and barely see doctors, but they're doing great. Well, yes, you could say the one who was in the Advantage plan saved a lot of money. One catch is, did she save it or did she spend it on other things? Because the one who had that original Medicare Medigap, when their bodies start breaking down, she just keeps paying her premiums, whereas her sister suddenly gets hit with co-pays for this hospital visit. Now co-pays for the MRI that she needs, and other things, and that's right, higher drug. I mean, they both will have drug costs, but so it's that sort of, sometimes for some people, and again, I'm not trying to say everybody and all these situations are different. For some people, going into an Advantage plan may be penny wise and pound foolish. Let's see. Let me just see what else we got here. Oh, there's a sheet, again, this is with the changes of just Part D. Luckily they did this orderly. D for drugs. If I'm on original Medicare and I want to have drug coverage, I get what we call a standalone Part D, and the premiums for that are now for 2020 in the range of $13 a month all the way up to $99 a month. And there is a list of the companies that are offering drug plans. One of the important things that I should say about drug plans is, here again, sometimes people look just at the premiums. Not a good idea, because there are ways to look and try and figure out what your drug costs are going to be. And sometimes a plan with a slightly higher premium, maybe they put more of my drugs in Tier 2 instead of Tier 3, and that's going to save me a whole lot of money over the whole year. So the Plan Finder, which is something at the Medicare website, that's the way to figure out what your particular drug costs are likely to be. And wouldn't you know, the feds this year changed up that Plan Finder a little bit, so it's not quite as easy as it used to be.
Oh, Lord.
I know. It's still pretty easy, but one thing is, I don't know how many of you have dealt with this before, but they want you to create your My Medicare account. These are very safe. I don't worry so much about the security, but the advantage of doing that is that it will then, besides just remember what drugs you took last year, it looks and sees what prescriptions you filled in the last year, so that it makes it easier going forward to say, oh, take that one off my list, I don't use that medicine anymore, add this one to my list. And it will hold on to that. So once you have your list of medications, then you can look at standalone drug plans or Advantage plans that have drug coverage to figure out which one is going to be the most cost effective. My husband has been on Medicare for 6 years now, and I think I have changed his drug plan 4 out of those 6 years. Because it was, and he's not even on too many really expensive drugs, but he has one that ends up in that Tier 3. And so this year, a different one is offering that at a slightly cheaper, level. So if there's one thing, and this is something also that PCOA can help people with, and I do have it. I have things where if you wanted us to do that drug search for you and send you the comparison of the 3 plans that seem most cost effective, I will give you handouts so that you make a list, and I think we have a new thing because we have to get you into a MyMedic, we'll figure out exactly what you need to do, but we can help you with that. I should say, if you are good with computers or you have someone around who can help you, who you can trust, who is reasonably good with computers, it's not that hard. The plan finder is not that hard. You just have to pay attention to what you're doing. And one thing I noticed was when I first ran it, and for the sort, it sort of put me on lowest premium, and then I changed it to lowest premium and drug costs to be able to compare my true out-of-pocket costs on drugs. Because, as I said, if it's just the premium which is low, but I'm paying much more on the drugs themselves, not such a great thing. And I'll throw in just a little story with this. I had a guy, and he or his wife was retired from the state, so they were eligible for Arizona State retirement system, which can work very well for a lot of people. Arizona State ASRS pays very well on medications. But the plan up till had costs to it, a premium. So he was feeling like, I'm spending too much money on this. So he meets with a salesman looking at other Advantage plans. So he used the term, is my medication covered? And the guy said, oh yes, your medication is on the formulary, it's covered. Well, what he didn't say and didn't look at was, for this guy over here, when he was on the ASRS plan, I think he was paying $100 a month for this medication. On the plan, on that Advantage plan, they were charging a much higher, I think it was like $2,000 a month for this medication. It was that, as I say, ASRS plays very well on medications. So if the guy had said, yes, it's on our formulary, but the copay will be $2,000 a month, the person may have said, well, then it doesn't make sense for me to leave, the Advantage plan I have through ASRS. And I'm not saying it was the guy's fault, but you got to ask the questions and know the terms. Covered doesn't tell you what the cost will be. And again, and I would also say, and please excuse me for sounding critical, some insurance agents and brokers are great, and they are really trying to serve you as clients and get you into something that's going to work well for you. Others don't know that much about what they're doing. I would put my knowledge of Medicare against theirs anytime. Because again, for the average person, yeah, sure, this plan might work really, really well. But most of us aren't average. We have issues, that we need to know, how is this going to work for me? 2 other things with Advantage plans versus original Medicare that are worth noting. And I do understand when you're not yet 65, you are limited. Durable medical equipment. Durable medical equipment is part of Medicare Part B. So again, if I'm on original Medicare with that Medigap, and I need durable medical equipment that's going to last at least 5 years, and I qualify based on what the doctor is prescribing and what I seem to need and all that, since it's Part B, Medicare pays its part, my Medigap pays its part. If you look with all of the Advantage plans, if you are needing durable medical equipment, you are back to paying 20%. That includes diabetes supplies.
Includes diabetes?
Yes, because they are Part B. The other thing which is Part B, and this is again becoming more of an issue than it used to be, is the kinds of treatments that they are now doing for cancer and other things, where you are going to a doctor's office or a clinic and getting infusions.
Right.
Those fall under Medicare Part B, not D, because the D drugs are those that I can go to a pharmacy or have mail ordered to home. If I'm going to the doctor's office and getting these infusions, that's part of Medicare Part B. So again, Medicare pays its part, my Medigap or other supplemental pays its part. Over on the Advantage Plan site, I am back to paying 20% for that medication. So that's something to factor in.
To your durable medical equipment thing, 5 years is too long for a brace.
Yeah, yes.
Crutches, yeah, but a
Right.
brace?
I
Three.
know, and that is,
Three's the
right,
number.
and that's a problem. The other thing that while we're jumping into some things about durable medical equipment, because that's the other thing you will see ads about. So there used to be one that would be, on Medicare, have back pain, call this number. So then it had all this stuff in little print, so I paused the TV one day and wrote it down. And if you call them, a couple things. Well, one thing is you're signing off rights to privacy. It says in there, now we can contact you about anything, much less just braces and things. So you're on the list. And it says if I have opted out on getting calls, by calling this number, I'm giving up that right. The other thing about it that I say is, if I buy that brace from them, because what they're either going to do is have a doctor who's never seen me sign off on something, or they send my doctor a big stack of things and they get confused and just sign off, figuring, well, if they need a brace, they need a brace. But what they send me is much cheaper than what they bill Medicare. And in some cases, it is cheaper than what I could buy myself at Walgreens or CVS without even using Medicare. And if I then the next year my back's still hurting and my doctor's prescribing something better for me, Medicare is going to say, you got a back brace last year, 5 years till you can get the next one. So my answer with that is, don't respond to the ads on TV. I don't try and tell people what to do much, but I will say that one with a lot of certainty. These are, as we say, lead generating agencies. Their sole purpose is to you in. And that's also true. Please nobody report me. It's Joe Namath who has the commercials. Usually I just am vague and just say some football player. But his is for Advantage plans, and I paused the TV to look at what they were saying. Because he says, you may not be getting all the benefits you're entitled to. Well, that makes all of us kind of go, I want everything I'm entitled to. Why am I not getting what I'm entitled to? So again, one thing is they are saying, the government is letting Advantage plans add new benefits. Yes, that is true. However, he's not saying our plans necessarily have those new benefits. It does say in the little letters, we may not have information on all the Advantage plans in your area. They're selling. They are selling. So, again, be the smarter consumer. Don't necessarily respond to those TV ads. And back to have back pain on Medicare, go see a professional about it. So be suspicious of what you see. There was also a case. This is one to note. It was in New Jersey. This nonprofit agency started contacting senior centers and saying, we'll come and bring an ice cream social for your residents or your participants. Oh, sounds nice. Everybody's short on money. They're glad to do it. And then when they're there, they sort of go around to everybody and they say, let me just get a swab from inside your cheek and your Medicare number. And they billed for genetic testing, which is very a specialized benefit for people with certain conditions. It's not supposed to be used randomly, but this group got probably $250,000 before they got reported and eventually got in trouble for it. So if you go to a health fair and they're doing blood pressure checks, should they need your Medicare number?
No.
Absolutely not. But another thing, as I have seen at some health fairs, they have a van set up to do mammograms. I'm not saying you should get it that way, but you can. And they would get your Medicare number because they are going to put in a claim to Medicare. Because in some situations, depending on how long it's been since I've had a mammogram and things like that, it is a preventative service and I am not going to have to pay anything for it. But they get paid by Medicare for doing it. But ask questions, be a little suspicious. If someone, I mean, we give this stupid sort of example because we don't hear about it that much, but, oh, well, you know, let's say, you know, at some senior living center, someone comes knocking on the door and sort of says, we'll bring you, you know, groceries every month. If you just, you know, sign off on these forms and let me write down your Medicare number. Now, most of us as we're sitting here say, how does anybody fall for that? But people aren't always thinking. You know, I mean, there was a case in Florida. This woman went every week and signed off on forms, and they sort of said, just ignore your Medicare statements, and they gave her money. Well, I think she kind of knew that she was a part of a scheme.
Right.
You know, people think, well, they're not going to scam on me. They're not going to get money out of me. I don't have any money. They're trying to get it from Medicare and from Access and things like that. And if they get your number, they can do it. Yeah.
Now, with our group,
Yeah.
I would venture to say that every single person in this group uses durable goods.
Yes.
And it was a huge scam with the scooters.
Yes. Yes.
You know, and Medicare has very specific rules for getting a wheelchair.
Right. Very specific. I mean, as I say, and I say this stupidly because you know I'm hopefully a little smarter than this, I might think that I need a scooter because, you know, my leg's giving me some trouble. But if I don't qualify based on this, Medicare's not going to pay for it. But let me say one other thing really important. No, let me let you finish. Go on.
Well, and if you buy a scooter at your doctor's request, then you find out it doesn't work for you, Medicare will not pay for the wheelchair until 5 years have elapsed.
The other thing I was going to say, and this is a little convoluted, so it's a little tricky for me to explain, but I'll do my best. Up till about a year ago, Medicare had done this big push where they had durable medical suppliers like reapply, and they knocked a lot of them out of the system because they were charging too much. So there was a smaller number. And you can look at if you're on original Medicare, you look at the Medicare website, you can see who are suppliers. If you're in an Advantage plan, you got to go with who they are recommending. They fiddled with the system some now. And one thing that means is, and again, if you're in an Advantage plan, you go to who they say, and if you're qualified for it, it shouldn't be a problem. But if I'm on original Medicare and I need durable medical equipment, the new phrase that you want to use in speaking to a supplier is, do they use, now I'm forgetting my word. It's not approved, wait, I gotta find my word. It's, do they accept, I'm blanking my words. I'm never going to find it fast enough. It's the participating, it's the approved Medicare rates. Because they sort of fouled with that system some. So if I go to a medical supplier and they say, you know, we are a participating provider, we accept Medicare's approved rates, I know I'm getting the best pricing I can get. If I'm being, and the problem is, sometimes I might need this equipment really kind of quick and send my husband or something and he doesn't know to ask. If they're not an approved supplier, they could start charging me more. Medicare would pay its part, my Medigap would pay its part, and I would still be on the hook for some money. So it's the approved rate and the participating rate that you want to be sure any supplier follows. All right, let's see. So the one that has on one side, please return your evaluation, we're not doing that, but flip to the other side of it. And so, I'm sorry, I'm just going to, since we didn't set up the whole thing, I'm just going to point to different things. As I said, from this very first picture here, bottom right, when people are on Medicare, they are either original Medicare with a Medigap or some sort of, let's see, so if you have show me this side, yes, this side, flip it over.
Is it in this other one?
Yes, that's the one, the bigger
Yes.
one. So this is actually our first page that starts with understanding Medicare. So just, my only point here was, because we come back to this slide all the time, is just this: you're either original Medicare, ideally with a Medigap and a drug plan, or in an Advantage plan. So I know we have our staple up here, it's a little confusing, and we don't have numbers on these pages, so it's a little trickier. Let's see, I'm now looking where it has the 1965 up on this top piece here, but down on the bottom right, most people, nearly everybody, don't pay, no, I'm not saying that right. Most everybody does not pay a premium for Part A of Medicare. And that's because it was taken out all the years you were working. Small number of people, particularly people who emigrated into the country legally in their 50s, may not have enough work credits, or people who never worked enough and don't have a spouse who worked enough. They may have to pay for Part A, but nearly everybody doesn't. And that's what it's talking about here. And again, the inpatient deductible next year is going to be $1,420. When you flip over, so that our upper left is your original Medicare 2020 Part B cost projected, they are projecting that the premium for Part B is going to be $144.30. For most people, that comes right out of your Social Security check before they let you touch the money. Now, for people who earned a lot, meaning as an individual over $85,000, no, it's actually going up to $87,000 and up to $174,000 as a couple, they pay more. And I know we all feel very sorry for these people, and there are tiers on that. The couple things about that: it's only about 5% of all people on Medicare fall into those higher categories. They base it on your tax return from 2 years ago, because they know they can have 2 years ago return. But if let's say I'm new to Medicare, I'm just hitting 65, and 2 years ago I had this fabulous job and I had a giant salary, but I've stopped working already, I could go to Social Security if I can document that I'm no longer working and that my income has already gone down. And then I shouldn't have to pay that higher premium. The annual deductible next year for Part B is $197. And you guys probably know this, but often when I do these classes, people don't always know this. It doesn't mean at the beginning of the year I write a check for $197. It means that when I go see a doctor, let's say that approved Medicare rate is $200, it means I'm paying that first $197 before they will start paying. So if I had 2 doctor's visits in January and they each were, the approved rates were $200 each, for the first one I'm paying the $197, Medicare's sharing with me those last $3, and then we're back to them paying 80% on that next one. I've met my deductible. When we talk about the supplementals, I talk about Medigaps because that is something that anybody has the right to buy when they are 65. And the other group that they do not let them sell Medigaps to are when people are already on Access, which is Arizona's Medicaid system. And the reason for that is there clearly have been times where insurance folks have exploited lower income people and sold them Medigaps when they were really not in a position to pay for them. The big one that many people, TRICARE, for those who served 20 plus years in the military, that people who are on TRICARE have to get Medicare, but then their TRICARE supplements their Medicare, and what we often consider that kind of a gold standard. That works very well for people. Now, on this, and as we say, the retiree plans, like if I worked for the state or I'm entitled to ASRS, they have a couple different supplements that I could use with my Medicare, but I have to take my Medicare. The only group who has a little more choices are those who worked for the feds, who are entitled to federal, FEHB, Federal Employee Health Benefits. The catch for them, and it's not a catch, it means they have more choices. They could take Medicare and keep an FEHB plan as the supplement to Medicare, but they have the right to just stay with their FEHB and keep the structure of their coverage in that way. Why I say that's a catch is they have to then figure out a little bit of how much will it cost me if I do this, how much will it cost me if I do that. Everybody else sort of has to work with the Medicare system. Even now, if I worked for a big employer, group, chances are if they offer me anything in retiree health benefits, it's going to be connected to Medicare either as a supplemental or as an Advantage plan kind of structure. Let's see. Okay, so just a few other facts about that. I got to see where I'm going. This is so backwards for me. Something that I'll just point out to you, down here, bottom right, where it talks about Part B excess charges. And I just want to explain that because we have three categories of providers. Participating providers, non-participating, and opt-out. Opt-out truly means they don't take Medicare at all. So if I'm calling to a doctor's office and I say, does Dr. Z take Medicare? And they say, no, Z has opted out. It means I can't submit claims to Medicare at all. It means they will have me sign an individual contract. Now, most of us are not going to go to doctors who don't accept Medicare. And I'll tell you the groups that mostly opt out. Pediatricians, kind of obvious.
Right.
Dermatologists, and there, clearly there are a lot of dermatologists who do take Medicare. The ones who opt out are the ones who are doing much more to beautify us than to heal us. And the other group, and this is kind of unfortunate, is there are a lot of psychiatrists who opt out. And it makes it kind of hard for people on Medicare to find psychiatrists. It is a trickier thing. So those are ones who have opted out. Participating providers, and when I say providers, doctors, labs, even hospitals, participating means two things. One, it means they accept Medicare's cost structure. So if Medicare says this kind of visit is worth $100, that's what they're going to take for it. And again, Medicare will pay 80%, I would be on the hook for the remaining 20, or my Medigap would be. A non-participating provider has the right to charge up to 15% more. And so what we're showing here with these excess charges is that plans F and G would even pay that 15% excess, whereas the others wouldn't. So if I have a plan C or D and I go to someone who is non-participating, I might be on the hook for $15 if it were a $100 charge. One of the big places that is non-participating, meaning they take Medicare but they are allowed to charge more, is the Mayo Clinic up in Scottsdale. So then we're not talking necessarily about just a $100 bill, but we could be talking about much more that would have that 15%. The other thing to note about that is if I go to a doctor who is a participating provider, I show them my Medicare card, I show them my Medigap card or whatever supplement I have. They bill Medicare, and then there's the crossover. Medicare sends it over to my Medigap. If it's been approved, they send it over, and then I don't have to pay anything out at the doctor's office. A non-participating provider could make me pay up front, and then they would help me submit the claims and I would get reimbursed. So it could be a little bit more complicated. I can tell you that currently 90+% of doctors are participating providers. Will that change over the next decade or two? We have no idea what's going to happen over the next decade or so. One thing I do say is generally with Medicare, well, with Medicare, luckily, changes come slow. For one thing, there are lots of people objecting if they try and change things too much. And even like this change about the plans F and G, the C and F, they put that into law, I think, 5 to 6 years ago, and allowed a lot of time to catch up. Yeah.
Well, now,
Yeah.
providers
Yes.
that are participating and
Yes.
not participating, if you're traveling, does the same thing apply?
Very good question. So one of the things is original Medicare, and again, when I talk original Medicare, I am usually imagining that someone has a Medigap or something, because most do. But even if it was just original Medicare, I can see any doctor in the United States who accepts Medicare. So if I'm traveling and I start feeling some pain, and again, I don't think it's life-threatening, but I'm visiting a friend and she says, oh, let's call my doctor and see if you can, see him. If I have original Medicare, I can see a doctor in Minnesota tomorrow, and they can submit a claim. Whereas if I'm in an Advantage plan, most of the Advantage plans are HMOs. If I go outside the network, they're not going to cover it. Some are PPOs, and the thing with PPOs, it does allow me to go outside, but I have to get that outside doctor to agree, and it's going to cost me more. That's one of the things, and I'll talk about that more when I talk about with Advantage plans. If I'm talking to someone and they have that house up in Minnesota for the summer, well, an Advantage plan that's an HMO that's based here in Tucson, all they have is emergency coverage up there. And it's emergency, meaning they, like if I break my leg, of course they're going to pay to set my leg, but some of those follow-up visits might not be covered because they would expect me to get back here.
I broke my shoulder in Florida last year.
Right.
And emergency room only.
Right.
And then I called them and they approved one follow-up visit, but I needed surgery and could not get it done.
Wow. Right. So, again, we got issues with that. Original Medicare, it doesn't matter. So the participating only, that is one thing that some people really like with original Medicare and the Medigap.
I can't wait till I turn 65.
There you go. Right, because one of the things is, I say this jokingly about one of my girlfriends. If you tell her something's wrong, that you've developed something, her first thing is always, who's the expert? Who's the doctor here in town that you should see about that? There are some people who are always going to want to say, I want to see the person who is the very best. Well, again, original Medicare, and that person's willing to take me, I can go see them. Advantage plans, particularly HMO, unless they're in that network, I can't. Networks become very important, and actually let's keep moving through and we'll talk more about that. So on this page, Medicare Choices, Medicare Advantage Part C. So just so people fully understand, you are still on Medicare if you are in an Advantage plan, but it is being administered through an insurance company. Does mean that there is this other level of bureaucracy in there. Yes.
What they do when I see a doctor is they take my Advantage card.
Right.
They don't want my Medicare card.
Exactly.
They want the Advantage.
Yes.
Exactly.
Card.
It's like a private insurance,
It
basically.
is.
Yeah.
It is. They have to, so your Advantage plan has to follow Medicare's rules. And one thing is, again, you do have some rights to appeal if something isn't covered, to, push. No guarantees that it's always successful, but you have ways to do that. So as I've been saying over here, types of Advantage plan. Most are HMOs, meaning you stay in network. And I would say, or I should say, here in Pima County, one way that we are luckier than most is we are a very competitive market for Advantage plans. That's why most Advantage plans here don't charge you an additional premium. If you foolishly, may I say, decided to move up to Casa Grande, you wanted that quieter life. Well, you'd probably have many fewer Advantage plans to choose from, and they all would have a premium because they don't have as many doctors. I mean, it's just a smaller place. So networks become very important, and I do say for people who already have relationships with some doctors, call to those doctors' offices and say, which Advantage plan, speak to the business manager, the office manager, which Advantage plans does the doctor participate in. The plans also should online, you should be able to see a list of providers, though they're not always up to date.
Well, also too, the doctor has to do a yearly opt-in for different Advantage
Yes.
plans. And I had a long-term specialist have to not see me anymore because they changed, they didn't take my Advantage plan.
Right. And connected to that, those of you who have been in Tucson for a while may remember a couple years ago, it was like Northwest Hospital and maybe Blue Cross, and then there was another time where it was the Carondelet Network and United Healthcare. I might have what these relationships were wrong.
They fought it out.
They fought it out, and they usually came to an agreement. But what that meant was, if I was on a Blue Cross Advantage plan, and they severed their relationship with Northwest, and I had a doctor in the Northwest group, I couldn't see them. But let me just point out so you know, if I'm on original Medicare with a Blue Cross Medigap, I'm not affected by that relationship because I'm just in my own little relationship. Now, again, as we say, most of them, they worked out some of this because Carondelet didn't want to lose all of those patients. You know, I mean, they are trying to, they're trying to have patients, they're trying to serve, but they're also trying to get paid. So if they feel like that Advantage plan is really trying to stiff their group, they may get out of, working with them. You will have some doctors' offices in this town where they are on, kind of 5 to 10 of the Advantage plans. You will have others, where they're not taking any Advantage plans, but they take original Medicare. And what she said too, if I am in an Advantage plan, that is the card that I show doctors and clinics. I have one girlfriend, and no matter, it took a while before she understood this. I would tell her, you're in an Advantage plan, but when she would call to make an appointment with a new doctor, she'd say, I'm on Medicare. And they'd say, oh, sure, we'll set an appointment. And she'd get there and they'd go, we don't take this Advantage plan. You have to follow their rules. Yeah.
I see here it says where I'm with the state retirement system.
Yes.
I retired before I was eligible for Medicare. And my current doctor's office has been wanting to see, well, we want to see your Medicare card. We got to see your Medicare card. I don't believe I ever got one. Because I was with ASRS before I got
You probably have one somewhere.
I don't remember.
Right. Well, one thing, now do you know, a couple years ago, and this connects to what he's saying, a couple years ago is when they changed the Medicare cards. And because it used to be based on either your or your spouse's Social Security. It took them a long time to say, maybe we shouldn't do that. So then they created these new ones and they sent them out. And this would have been 2017 into...
No, actually,
Was
I got
into
mine
19?
this year. So,
I got mine this year too.
Okay.
so 18, 19.
Okay. So if you truly... dropping my glasses. If you either try going to the Medicare website, putting in your information. If you think you know your Medicare, see, no one with these new numbers will ever remember them because they're, so I would call them, look around the house, see if you stuck it in a drawer somewhere. If you really didn't, one thing is I say, once you set up that My Medicare account for doing the plan finder, you can even print out a new card. But if you can't find something with your Medicare number, and you might be able to find it through ASRS, because they probably have it, once you have it, you should be able to print out a new card.
Yeah, well, the ASRS people, it's with United Healthcare,
Right.
whatever it is, they say do not submit a Medicare claim.
But you are already now 65, or at least.
Yes.
Yeah, okay. You never know. So one of the things with ASRS, and this is really true with pretty much all retirement stuff, is that when you hit 65, they insist that you take Medicare because then your coverage becomes more of a supplemental. So you have a Medicare number, and you should be able to find out what it is, and then print out a new card for yourself. And if you really run into problems with that, contact us at PCOA, and we should be able to help you track it down. Yes, I'm sorry.
Excuse me.
Yeah, no.
I have a question about that.
Yeah.
Because I was on Medicare before I retired
Yes.
because I went out on a disability.
Okay.
So I don't have a card either. And they say, well, where's your card? And I say, well, I was on I was on Medicare long before I was of age to retire.
Okay. My guess, again, as I said to him, is they're generally pretty good about sending them out. So you may have gotten one at some point, but
I can look through, I've got my file.
I mean, looking through your files and seeing if you can find it. But if you don't, and I'm saying either it's sometimes Social Security or through Medicare, if you can find the number, you should be able, within My Medicare, to print out a new card for yourself.
But the people that I've gone to said, that's okay.
Right.
And they haven't,
Right.
so they bypassed me.
So are you now on more of an Advantage plan?
She's on Arizona retirement.
Okay.
Yeah, I'm on Arizona.
Okay, so I think with Arizona Retirement, what they have now, Arizona Retirement has two plans, and don't hold me to everything with the ASRS because I only know so much, but they have one that's more like an HMO and one that's more like a PPO.
Yes.
In their system,
Yeah.
they know you're on Medicare, you're being billed for Medicare, somehow through all that, you should be able to find your Medicare number. And in doing so, if you set up a mymedicare.gov account, you can print out a new card for yourself. That's one of the things they're touting as, the new help. So as I said, again, look for what might be in the file somewhere, and if not, try and get the number and pull out a new card. Print out a new card. And with that, for anyone who is not yet, well, everybody is on Medicare in some, or anyone not on Medicare at all.
Everybody should be.
Okay. The one thing I would say is also of making sure that Social Security has your correct address. Because if you're, because they're going to send out a card at 65, you don't want it going where you lived before.
Now, just because I know Tana and Charlie, they don't really do much on the computer.
Right.
So they could go to a Social Security office.
Yes, absolutely, absolutely. And some people say the one on the south side is generally a little less crowded. I've also heard people say if you go in first thing in the morning, the wait is usually not particularly bad.
That's the one we went to with everything, and they were quick.
Right.
And they were understanding.
Right.
Especially when I was trying to get everything together.
I would also say some of the clerks at Social Security understand Medicare somewhat well. Others
But when you go into that office
Yeah.
now, they ask you what you're going there
Yes.
for, and then they divide you up and you get an agent that knows what
That's
your
right.
situation.
Right.
So if you say Medicare or you say lost card or whatever,
Right.
you'll get
They
sent to the
should be
right
able to
agent.
help. And I would say it's a good idea to have the Medicare card someplace. Even when you have, because with ASRS, because those technically are Advantage plans, they are a group Advantage plan, that's the card you're using when you're, getting services, so you're fine in that sense, but it's good to know that you have the card somewhere, and particularly, you need it less once you set up a My Medicare account, because you can do more online. And please, again, I know I jump around a lot, but do contact us at PCOA, particularly if you want help with the drug plans, to look and see if making a switch would be better in terms of your coverage for drug plans. The catch is, if you're in an Advantage plan, so let's say I'm on this Advantage plan, and I see over here with this Advantage plan, maybe I save some money every year on drugs. And it's not, depending on what medication, maybe it's a lot, but all my docs take this plan and they don't take that plan. So you are always kind of balancing out, how is this going to work, what's going to work, best for me. Yeah. Time, okay.
So we're gonna have a little break.
All right.
And so
Think of what other questions, I'll try and find what other things I have to tell you. And it has a different kind of model, and not that many people signed up for it, but I just want to explain it. So on this list of Advantage plans, and the next one, the types of Advantage plans, there is this thing called an MSA, which is a Medicare Savings Account. Now, it's kind of gimmicky. I say gimmicky. It's just, here's how it works. If I were to sign up for that plan would deposit $3,240 into the equivalent of a health savings account, but they're calling it Medicare Savings Account, for me. And I can use that for my health care. However, the important thing to note is that my deductible on that plan is $7,400.
Those are deductible.
Right, so the people who this is, quote, good for are those who are unlikely to need much medical care. Because if I'm someone and I just go to my regular doctor, one specialist, one lab test, and my total medical cost with those couple of visits would only total up to, let's say, $300, it means there's still $29.40 or whatever in that account for me. And the next year, they would give me another sum of money to use. So if I use very little medical care, it may be a good deal. But, so let's say I did this, and for 2 years, I was one of those people with just a visit or two to a doctor. So I've really racked up some savings. Well, I can use that money for other medical things, like maybe I need a crown or a root canal. But that doesn't count towards my Medicare costs. So I use it for my tooth, and I'm allowed to do that, but then life goes south, and I end up in the hospital, and now I owe up to that $7,400. Above that $7,400, they pay 100%. But if I don't have, so I only in my first year kind of have about half of the money that I might need if I needed a lot of services. So I tell you this just because it is one of the Advantage plans that is around now, but it is a new model, and we don't know that much about it because it requires doctors to say, yeah, I'll work with this or whatever. So it's a little trickier. No networks, but not necessarily best for everybody. I'm on the page where the top left says Part D costs.
There's a page number at the bottom.
Oh, thank you. 7. It says 7.
Oh, boy.
I didn't
7.
see these page numbers till now.
Oh, there.
Wow,
Thanks, Vikki.
my life is so exciting.
Depends on the company.
Most of the Advantage plans include drug coverage. That's true with ASRS, with federal, and all of those kinds of things. A few don't, but people know that when they're signing up for them. Original Medicare and the Medigaps don't include drug coverage, so that's why people who stay on that side of the divide also get a standalone drug plan, and that's what I was talking about, different premiums. The lowest premium may not be the best cost-wise. And here's where we have tips for saving money. So let's say I'm cruising along and everything's worked well, and now my doctor has prescribed a new medicine and it is on a high tier. But myself and the doctor really feel like this is the right medicine for me to be on. You can ask the plan for a tiering exception. So maybe it's a tier 4 and they give it to you as a tier 3, so your costs are lower. Comes in again that sometimes the doctors have samples, always ask about that. If, let's say, middle of the year, the doctor prescribes something, but it's not on my plan's formulary, we could also make an appeal, a formulary appeal, because for the next year, maybe I'd switch to a plan where it is covered, but for the remainder of this year, they would cover it because the doctor is signing off and saying drug X works in a way that drug Z didn't. Those kinds of things.
Can I add one thing to
Yes,
this?
please.
How to save money piece?
Yes.
I've been going to El Rio Clinic.
Oh.
El Rio Clinic is a really well-organized, well-designed healthcare
Yes.
clinic. They have everything in-house, including
Right.
radiology, pharmacy,
Right.
psychiatry, dentistry. They have
Right.
all in-house, and they have a sliding scale based on what your insurance is. Just some information.
There you go.
They're
There you
wonderful.
go.
They're wonderful people. I've had.
That's
and
wonderful.
their pharmacy does the same
Right,
thing.
and I would mention them, and again, I'm not advocating, I am
No.
not pushing, I'm not, that's one of our things as a SHIP thing, but there's also, Marana Health is another
Marana
big
Health
clinic
Group,
or
yes.
group, and I just mention those because, many of us grew up with the idea of you see a doctor in their own little office. Well, the systems have moved away from that. And sometimes, as you're saying, there's a little more help because they have a structure for it. The other thing is pharmacists have gotten a little bit better about you walking in and before you hand them that script saying, how much would it be if we go through my Part D plan? How much would it be if I went through cash? And when I say cash, it doesn't have to be dollars, it can be your card. But also, can you get them a thing on GoodRx, a coupon to bring the cost lower? You can't use that if you're using your Part D, but let's say something was going to cost me $100 through my Part D, but with a coupon out of pocket, might only be $50. It's your money, so, look for those kind of things, ask the questions, and clearly ask about, is there a generic? Yeah.
Well, I am on a Humana prescription plan,
Mm-hmm.
and I've been paying $26.40 a month. Now I've got, that I'm going to be paying, what, $56?
Uh-huh.
But then I don't want to be on an Advantage, and I'm lip plan, and I look at this other. There's really not any point in me changing my drug prescription plan.
Well, how do I say it? So there's so many things in what she just said. One thing is, if I'm here in an Advantage plan, and this would even be true of those of you who have ASRS's Advantage plan. If I'm over here and someone tells me, oh, this standalone drug plan is really good, it's going to cover your meds a lot better, and I look and I think, wow, it's going to save me money. So I sign up for this standalone drug plan. That is going to knock me out of my Advantage plan. Because I can't be on an Advantage plan and have a standalone drug plan at the same
And that
time.
applies to you because you're on IBM insurance.
Well, no, I'm not.
Well, but it's not a
way.
real Advantage program.
It's not an Advantage plan.
No.
I'm
Right.
Medicare and United Health, and then Humana.
Right, so it sounds like, again, that you have original Medicare with a Medicap and a drug plan. So then what I would say is remember that when you look at the little list you can't see very well right now, and you have it in a bigger one, for the standalone drug plans, you cannot assume your total cost based just on the premium. For someone like you who has been on a plan and the premium is going up, way up, the most important thing I would say is to use this plan finder to figure out which plan would be most cost effective. Because either, in one case, it might be that the drug cost is about the same, but she can get on a plan where her monthly premium is $25. Just, you know, so then there she's saving that way. You know, it's figuring out whether it really has to do with where the drugs fall, which tiers they fall on. So, let's see.
And I was gonna just mention this.
Yeah.
Also, now they want me to get my prescriptions sent by mail.
Mm-hmm.
Well, I think Tucson is a little bit different than some other cooler
Right.
climates.
Yes.
I have 2 medications.
That-
The one I get for my eye
Right.
drops, I get them at the pharmacy.
Yeah.
They are refrigerated there, and I put them in the refrigerator.
Right.
And I have another one
Right.
also.
Which is, right, very important. Also, when you use that plan finder and look at drug costs, it will show you mail order versus the pharmacies. And mail order is not always cheaper. Now, one thing which is really important to look at, and some of us get lazy and don't look at this, but the different drug plans, again, with Advantage plans or the standalones, they have standard pharmacies that are in their network, and they have preferred pharmacies.
I saw that. What does that mean?
It means I'm going to save more money at the preferred pharmacies.
Walmart and stuff.
So that's it. So, and each one is different. A lot of them, if CVS is their preferred, Walgreens may be in their network, but it would cost me more. Or others, Walgreens is going to be where I save the money, you know, and CVS I would pay more. As I say, for my husband's stuff, switched from Walgreens to CVS this year because it's saving us more money that way. Because we changed his. What's that?
How do you find that out?
Because it should, well, with the plan finder, it will show you, it gives you the ability to put pharmacies in. Doesn't lock you into those. But what I say to people is, put in a CVS and a Walgreens, maybe the Walmart or whatever, Costco or whatever, so that you can see it and you will see a difference. And then if, let's say, it says with the preferred pharmacy, here's what my total cost would be, make sure then you're using that chain pharmacy.
Now, would your insurance book tell you?
It should,
What
although
your preferred is?
if the book doesn't tell you, their website would. Sometimes they don't put it all in the books because, well, it does change, although not too much with the pharmacies. But here's the thing, maybe here in Tucson with an 85716 zip, or the whole Tucson, it would be the whole Tucson area, maybe here CVS is the preferred, but if I were in, you know, Kankakee, you know, someplace else, maybe there are no CVS's in that county, so it's not the preferred. But on their website with your zip code, you should be able to, or their books should show you which are their preferred, and that is one of the best ways to
Or their
save some
customer
money.
service.
So-
Yes,
On the website, as she was mentioning, you enter your zip code, you enter all the drugs you're taking, and it can then give you a comparison.
right.
So it's true, I mean, it's not hard, but you got to do that, and then it shows you exactly what the numbers are.
On your insurance?
At the Medicare website.
At the Medicare
Or
website.
Medicare?
With the plan finder. I mean, as I do say, if you're not at all comfortable with computers, it will make your heart pound. If you're somewhat comfortable, you will get it, but this is also something that we can help you with. And so that number, which is plastered all over these papers for PCOA, what happens is when you call, you get one of our intake people who asks just some basic information and what you're calling about, and then one of the Medicare volunteers will call you back and help you with that. And specifically, they can help you with
So
that.
if I went to the drugstore
Yes.
and I asked them, are you preferred or are you standard, will they tell me?
If you know which plan you have.
Yes.
I know.
Yes,
Yeah.
yes. But again, remember, you know, I'm looking at my list closely. Let's see, I can see it on here. One of the things, and this becomes very important, because, okay, let me put it this way. If I will say to someone as I'm trying to help them, well, what kind of Medicare coverage do you have? And very often what people will say to me is something like, oh, I have United Healthcare, or I have Blue Cross. And I say those two because those are the biggest. Well, both of those, along with all these other companies, they have Advantage plans, they have drug plans, they have Medigaps. And when we talk about the standalone drug plans, Cigna has 3, Express Scripts has 3. You know, so I just say that to be sure you are saying to them specifically, I have, you know, here, you know, here's the card. Are you, you know, if it's a card, if you've been going, let's say, to Walgreens, and you have your Part D plan or your Advantage plan card, yes, you should be able to go into them now, because we're in this open enrollment period, and say, will you still, are you a preferred provider, and will you still be a preferred provider for next year? And they should be able to tell you that.
Yes or no?
That's right. Now, we are, as I gave you my example of if you moved up to Casa Grande, but I say this too about pharmacies, because I have to say, you know, we're really lucky here in town. If I switch to a drug plan and now my preferred pharmacy is CVS instead of Walgreens, there's going to be one within the
One in
same
every
distance.
corner. Yeah.
Most of us here, that shift from one to the other is no hardship. Now, if we were doing this presentation out in Ajo, where I have gone, they have a clinic that has a pharmacy, and I think one other. So they become a little more limited in their choices, unless they're driving into Tucson every week or two. So I mean, that's the Pollyanna in me. Yes, we're luckier than most people because we can get to the pharmacy, you know, fairly easily. That transition from one to the with a drug plan. If I'm on and with Advantage plans too. If I'm on original Medicare and I switch my drug plan for 2020, I get the new stuff in the mail. I get something from my old one saying, we understand you are stopping your membership in this. That transition works very, very well. And with Advantage plans, again, on a personal level, it may be harder because I have to switch doctors, or if I have to do that, that's trickier. But the part about having my new card and all that, and the system knowing what my insurance is, works fairly well. One thing I want, as we're talking here about drugs, but before I forget anything, let me see we're 7 down to 9. On page, what page is it? On the back of page 7, it doesn't say 8. There are a couple of things.
Probably stapled.
Yes.
Stapled.
Oh, no wonder I can't see. There's up in the upper left a thing about help with Medicare costs. So there are some Medicare savings programs. I would agree with most people that those limits are awfully low, you know, because people even a little bit above that are struggling with some of these costs. So we have 3 different kinds. I mean, they're all federal programs that are run through the state Medicaid access system. For those that are in the quote-unquote lowest income category, if as a single person my income is under $1,061 a month, or as a couple under $1,430, in addition, so I would get I would get the benefits of the state of Arizona then pays that Medicare Part B premium. So if I'm someone who's living on $1,000 a month and I didn't know I could get that benefit, and now I do, that means there's gonna be 100 and whatever, the 44 back in my Social Security check that wasn't there before.
Okay, now, I think it was last year when we were talking
Yeah.
about this, because I've been on Medicare, that my rate wouldn't be going up to the full top.
Thank you. Okay, so here's the thing with that. There is a thing called the held harmless rule. So let's say that they have already announced, I think, that there will be a slight Social Security raise next year.
Yeah, 1.6.
I know, it's never very high. So for someone, particularly someone who is fairly low income, even with that increase, if they're increasing the Medicare premium, if they put it through, it would mean their Social Security would go down. The held harmless rule says you can't make that Social Security go down. So if someone, they then come up with different rates for those lower income people. However, how do I say this? If I am, quote, so low income that the state is then paying my Part B premium, they're paying their standard rate. They're not lowering it for them. So this lowest category, in addition to that Medicare Part B being paid, at the very low, and the Medicare Part D, the premium being paid, and lowering my copays on drugs, in addition, for that lowest income group, they are entitled to access as well. So that then their supplement, in a sense, becomes the access system. And there are different ways that they can set it up and different groups they can go with. But those folks should have next to no out-of-pocket costs because they have very little income. The other two categories, which for whatever reason on our list are the upper two, in those cases, the state of Arizona pays that Part B premium and pays a Part D premium and lowers the cost on drugs, but that person isn't entitled to access. So if they are in an Advantage plan, they are still going to have copays and costs, but they will have less. And again, that Part B premium, not having that taken out is an important thing. And so we always want to tell people about this. We can help people sign up for those. The way I phrase it is that you are entitled to apply. And if your income allows, it puts you in that category, you are entitled to this benefit. The calculations of economists and others say that it would be a hardship to have to pay that premium, and this is one way the government can help. Yeah.
So why, when they do increase
Yeah.
Social Security, which is not guaranteed
Yes.
every year, why does my Medicare go out exactly the same amount?
Right, I think they calculate that, I know.
Collusion.
That's right. It's more of, one of the things we have to remember is, we have this, many people on Social Security, and my little line here is at all sorts of different income levels. So if I had worked at a really high level and I'm getting the maximum Social Security, it goes up a little bit. I probably can, I'm going to be able to cover that increase in my Medicare, but I won't see much change in my
Well, I
Social
worked at
Security.
PCOA, so.
There we go, I didn't know that,
Exactly
yeah.
what's going to happen to me is
Right.
higher income.
I know. It's a tricky, the cost is one of the tricky things. And I mean, I do laugh a little bit when I hear politicians talk about Medicare for all. Not that it isn't a bad thing to be thinking about how do we cover people and how do we get people the health care that they need. I am pro that in a million different ways. But they say it as if Medicare is simple. They say it as if Medicare doesn't involve private insurance already. So I just, and for anyone who doesn't know that, I feel like you got to understand that. I mean, I have to talk for 2 hours sometimes to explain Medicare to people. So
And that's the quick routine.
That's my quick version, right.
It's a short version.
Yes. Down here at the bottom, after it says our 5-minute break, is where it talks about kind of factors that people use comparing Advantage plans and original Medicare. Let's just see, couple last things, or a couple more things. For those folks, so I'm going to use you because you brought up being on disability, not being 65 yet. When she hit 2 years on disability, her Medicare card came in the mail.
A 2-year waiting period,
It's a
that's right.
2-year waiting period. The other thing is, if I am, so let's say, even ignoring people on disability, but let's say I started taking my Social Security at 62. If I'm taking Social Security for at least 4 months before my 65th birthday, that Medicare card comes in the mail. If I am not, so, you know, and this may be friends or anybody else in your family, I have to actively enroll in Medicare at 65. Then we talk about the people who kept working at 65. Technically, if I am working, and I am working for an employer group where they have at least 20 people in the group, or my spouse is working and I'm covered through my spouse, and that group is at least 20 people, 100 if I'm getting Medicare because of a disability. My work-based coverage would be primary, and I don't have to do anything about Medicare at 65. It used to be that we would say, take that Part A at 65. And you still can do that. But once I'm 65, and I'm saying this if I'm not taking Social Security, because if I'm taking Social, it will come in the mail. If I'm not, if I'm waiting till full retirement to take Social Security, but I'm getting covered through a spouse or through my work. I could take the A right at 65, but I can take that A anytime after I'm 65. I don't have to concern myself with enrollment periods. But for Part B, so let's say I'm sailing along and I'm still working, and now I'm 66, and now I'm 67. And then all of a sudden I decide that I can't take this working life anymore. I know, exactly. I've gotten too old for this. I could get but let's say, again, it's not a crisis, but I've just decided, hey, December 31st is going to be my last day. I could go to Social Security, or I could go to the Social Security website. I could sign up for Medicare, get everything to start on January 1, have my work coverage through December 31st. Medicare starts the very next day.
Now, most human resources departments
Yes.
will counsel you on this if you're still working. My last boyfriend is still working at 68, and
Right.
they called him in when he turned 65. Here's what you gotta do.
Right. And some, I'm sorry, go on.
I have a son-in-law that's
Yeah.
going to retire in this January.
Right.
And I know they're going through this. What do we,
Right.
what do we go, what
Right,
do we do?
and do let them know we're still doing all these presentations in the community if he wants to come, or make his wife come and learn about
Well,
it.
they're both working, and
Ah.
that's what makes it hard.
Right, we do some Saturday ones.
Oh, do you?
I'll give you the flyer.
Okay.
But here's the thing. Let's see. She was saying that human resources often knows. One thing is, again, depending, and I'm talking about if someone is still working or it's a spouse who's still working, they often will want you to take A at 65. And you can, but it is secondary to their coverage. They can't make you take Medicare. So let's say, right, if you're still working, because that would be discriminating against someone who's 65. So they cannot make you do it. The only people who definitely should not take Part A, if they are still working when they hit 65, are those who are working somewhere where they have an HSA, a health savings account. Not a flex savings account, but a HSA. Because the rule is you can't be contributing to an HSA and on any part of Medicare at the same time.
Right.
The county, their only health plan has an HSA, is my understanding, unless that has changed. So if this were a group of county employees, you would not take A at 65, because you might want to keep putting money into your HSA. The one thing to know is when you take the A after age 65, they retro it 6 months. And if you've made any contributions to your HSA during that time, there would be a tax implication because it's an excess tax or something like that. But many people, if they are still working or they are getting their insurance through the spouse's work, don't take Part B because at the time when someone's still working, because if your work-based coverage is primary, why pay for that Part B when you don't need it? Right. And the other thing is when we talked about that guaranteed issue of getting that Part B, getting that Medigap with no medical underwriting, if I did that while I was still working, again, I'm paying out more than I would need to when I have work-based coverage. For drug coverage, you can postpone that as well if you have what they say, it's really kind of silly. What they say is, you don't have to have a drug plan. If you don't want to have a drug plan, that's okay. But if you don't take a drug plan right at 65, or you don't have one that is at least as good as a Medicare drug plan, when you take it, you have a penalty for not having had it. And that's also true with Medicare Part B. If I have work coverage, I can postpone that B. But if I, at 65, was jaunting around the world for a couple of years and didn't take my Medicare, and then I signed up for it at 67, I would have a penalty for 2 years because I didn't have other coverage. Yes?
One other thing to note, it takes about a month for the coverage to occur. So if I, to use your example, if I'm retiring on December 31st, on December 1st, I should be filing for Medicare for the next year because it begins at the beginning of the month.
Right, and somewhere in here, I think it's page 8 or 10, it looks like a 10, is about you have your initial enrollment period is actually 7 months around that 65th birthday. And what he was talking about in terms of delays, if I do it in those 3 months before I turn 65, I'm going to get that card. My effective date of Medicare will be the first day of my 65th birthday month, even if my birthday is on the 31st. Now, one goofy Medicare thing is if my birthday is on the 1st of the month and I did it early enough, it would start the month before. I don't know why they do it. It's goofy. But connected to what Jim said is I have this 7-month period. If I wait till 3 months after 65, it's not going to start right away. They can even, as they say, it could delay up to 3 more months.
Right.
So I need to be careful about that to be sure that I have the coverage I want. One thing also, and I know I'm jumping a little bit here, but if I am waiting to take Social Security till my full retirement or till 70, but I start Medicare at 65, they're going to bill me because they don't have a Social Security check to take it out of. I had one client who I helped with this. Well, she was going to wait till she hit 66 before she started taking her Social Security, and they bill you quarterly for your Medicare premiums. Well, she was not the most attentive to detail. First notice, she ignores. Second notice, she ignores. The third notice says, if you do not pay your Medicare premium by such and such date, your coverage is canceled. And that's what happened to her. And then you have to deal with the general enrollment period, and it doesn't start. So she did not have that coverage, and you have penalties if you didn't have it, you know. So I say that because, again, I'm not trying to tell somebody what to do, but if someone is going to find it a real hardship to make those payments by themselves, you know, well then they may want to start their, I mean, I'm not telling them what to do about Social Security, but if that's a way to make sure it gets paid and not lose, you know, their health insurance, it's not worth waiting till the full retirement. You know, if they bill quarterly, you can set up to have automatic withdrawals, you can pay by credit card, all sorts of things like that. But you got to pay the premium or you lose the coverage. Let me see, what last important things? As I say, really the plan finder is really important, and if you can't do it yourself, by all means contact us and let us help you. So when we talk about changes, this is our open enrollment period, and I'm sorry, your hand was up and I missed it, didn't I?
Continue on.
Okay.
You come back to me.
Okay, I'll come back. So I just want to say, October 15th through December 7th is the open enrollment period for Medicare. Easy to change Advantage plans, easy to change drug plans. You can also during that time period go from original Medicare into an Advantage plan. You can go from an Advantage plan back into original Medicare by signing up for a standalone drug plan. What I do caution people is if they're looking to go back to original Medicare, they want to make sure they can get that Medigap before they make that switch, because they might have stayed on their Advantage plan if they couldn't get that Medigap. They have also, for people in January through March, people who are in Advantage plans can switch between Advantage plans or go back to original Medicare, but other people can't go into the Advantage plans during that time. And the other thing I would say, and then I will get to his question, is there are certain times that we call special enrollment periods. So if I move, so I'm perfectly happy with my Advantage plan here in Tucson, and then for some reason I decide to move up to Phoenix. I have 2 months, I could sign up for a different Advantage plan then, but I also have the right to get a Medigap at that point and go back to original Medicare, because I have left my service area for my Medigap. So if you move, the other thing is if you move into or out of assisted living, you have a special enrollment period to make a change. Let's say someone was saying maybe that their former employer used to have a retirement plan, a health plan. They've decided not to do it. That gives you a special enrollment period that you can sign up.
And I noticed on this same list is chronic condition.
Yes.
I am listed with my doctor for my post-polio syndrome as being a chronic condition.
Right. So there are a few, and I'm just looking to see if I have them here. There are certain Advantage, right, there are a few Advantage plans that are specific to some conditions. We don't have too many, and I do have a few to show for people with diabetes, people with heart issues. Now, does not mean I have to go into that plan, but the plan is trying to serve these people well. And if, let's say, I'm diagnosed with something and I think the plan will work for me, I can join it. Yeah.
So coming back, the plans are this year seem to be touting additional benefits that are not part of the traditional Medicare.
Yes.
Vision,
Yes.
as you mentioned, diabetes,
Right.
you know, durable equipment, hearing aids, that kind of stuff.
Right.
So how does that work?
Well, they on our sheets about the Advantage plans, they list some of the extras. And that can be great for people. However, those extras don't count towards my out-of-pocket maximum.
Okay.
What they offer, particularly regarding dental, is generally pretty limited. So it's the cleaning and maybe the x-rays. And some of the, you know, there are a few Advantage plans that are also specific for the lower income people who are Medicare and Access. They throw in a little bit more sometimes, maybe some over-the-counter supplies that people can get. There was talk that some special things that they would be throwing in might even be rides to the doctors. I don't know how much that has fully translated into what the plans here are offering.
So do we have to just go out and ask?
Well, let's see.
Probably.
Our things here, I'm looking for one other that has, let me just,
Yeah, I'm thinking of hearing and hearing aids specifically.
okay, these, so, I'm sorry, I'm a little, this over here without a tag is for the special needs plans that are like for diabetes and heart care. Over here with the HMOs, on these sheets, I hadn't looked up. We tracked what we could about what extras. And so down at the bottom, it says extra benefits and costs. So this is giving you on HMOs, and there's another one with PPOs, what extras do they throw in, and how do they price that? Okay. So that if there were two and you're thinking, hey, maybe this is a good thing, call to their customer service and ask them more about it. I do say, if you're in an Advantage plan or thinking about an Advantage plan, call to that customer service line. See how they treat you when you call, you know, how helpful somebody is, do they seem to know what they're talking about, those kinds of things.
Yeah, that's how I chose my Advantage plan, was their rating. Mine doesn't have a 5-star rating,
Right.
but mine has a 4-star rating.
Yes.
Because I chose one that had a good customer service ranking.
Right.
When it met all my other needs,
Right.
then I chose the one that had the best customer service ranking.
Right. So up here it's on a 5-point scale. We have no 5-point HMOs or drug plans here in Pima County. The closest we come are some 4.5s. Now, if I'm looking at one and I'm looking between a 4.0 and a 4.5, I may not experience much differences. If I had a bias, I would sort of say, stay away from those things under 3, because then chances are people have had more problems with them.
You might want to open it up to questions.
Yes.
I think we've got about 5 more minutes.
Okay, all right. So what other questions can I answer for you? And I will then give you a chance to come and get stuff.
Say I want to switch from Advantage to Medigap or vice versa.
Right.
I go look at all the information and I make my decision based on the website, the Medicare website. Then what?
Okay.
Can I do it online?
Well,
I have to call the customer service company.
okay. One thing is, if I'm using that plan finder and looking at my medications and looking either at Advantage plans or as standalone drug plans, they have a little button that says enroll. I can push that, I start to give more information, and then they send me more. Now, as I said, Medigaps are a little bit different. So if I am looking at a Medigap on the, we have a handout here that you're welcome to, which has the companies that sell these Medigaps here in Pima County, and it does have a phone number. You can also find websites, and you approach them. And again, if you are not in a guaranteed issue period, they can ask you about your health. So that's the one cap. And they can turn you down if you're not in a guaranteed issue period. Also, with all of them, also for the Advantage plans, for the drug plans, there are 800 numbers and websites, and you can sign up directly. And what they say also, like with a Medigap, as I say, if you've been in an Advantage plan and you are thinking that you want to go back to original Medicare and have a Medigap, this would be the time to be sure you could get the Medigap before you get out of your drug plan. Before December 7th. Yeah. What other questions? Anything else?
Yeah.
Yeah.
Maybe I should know, but
No.
if your gross monthly income is at or below, does the word gross mean before the insurance is out or after?
It means before. And connected to that is when I talk about that IRMA, the higher fee for high income, they look at what's called modified adjusted gross, which they get right off of taxes. For the assistance, the Medicare Savings programs, those are administered now, not just now, they were administered through the Arizona Department of Economic Security. So Social Security counts as income, pensions count as income. They look at all that and they determine if you fall within the categories or above. Right. Yes, there's some, what I was trying to say is it's like, if I have a big, a trust or something, if I'm not taking money out, it's considered a resource and not income, so it would not count.
Go
but
ahead and sign it.
it's the income that they're concerned with. And one thing when we talk about for the Medicare Savings Program, inevitably somebody will ask, does that mean that somebody could live in $1 million home, but because their income is low, they would qualify? And technically, yes. But I like to say, if they are really living in $1 million home, they do not have enough money to pay their property taxes, because
Insurance.
or insurance, or all sorts of other
Everything.
So while I work, I don't see that much in the way of that exploitation. I see more people who are just above these levels who could really use help who aren't able to get it. I have seen people over the level to get help by $2, $10, it breaks my heart.
Yeah, that's like I asked for assistance with my power bill, and I made $20 too much each month. $20.
Right, yeah.
Right. It gets tricky. So why don't, come up and get papers, or, because we got different things here.
Yeah, Vicki, I would also like
yes.
to take some of those to our holiday luncheon for people
Okay.
that have not been able to attend.
All right, we'll make sure you have some. And we also throw in, a little something about the enrollment fraud. As I like to say, most insurance agents are good people who are not trying to exploit you. And, one of the things about our program is I can't be handing you out cards to send you to somebody. And people sometimes think, oh, but you must really know who the good agents are or what the good plans are. No. Particularly with agents, I don't know if one is better than somebody else. What I'm hoping is that I give you some skills so that if somebody says to you, oh sure, you can sign up for this HMO Advantage Plan and you can see any doctor you want anywhere in the country, I'm hoping that you'll think, that nice lady from PCOA told me that was going to be a lie. And it is. Or ask questions. Or if someone is saying to you, oh, well, this is a good plan for you. Say, well, ask them questions. What makes you say that? What are you thinking about? So that so that you find out maybe there are some good reasons why it would be a good plan. Find out what you can. As we say, we give second opinions. You can call with our, assistants at PCOA and say, they were saying such and such. Does that sound right to you? So go with that. So thank you. Oh, you come around and get papers and I'll take what last questions. And she filled out the evaluation. If you want to do the evaluation, I'd love it. I'll take it.
I'll get out of the way.
Stampede.